Thanks everyone for joining. And as a note, this meeting is being recorded. We want this presentation to be available later, and so we will be recording it and it will be available on a YouTube channel. There is a link to that YouTube channel on the DSPD website under other providers and then trainings, and then there's a link. And when I get a second, I will put a link to the training playlist in the chat. Since this is being recorded, we ask that you please keep yourself muted, and if you have questions, type them into the chat. There will be time at the end to ask questions. So for those of you joining by phone, you could come off mute and ask your questions then. Our next training in this training series for support coordinators and providers will be held Thursday, November 21st at 1 p.m. Next month's topic is rights restrictions and modifications. So watch for the invitation to be coming in your inbox via email in the next week or two. And so today we are talking about the roles of individuals in the person-centered support plan meeting. And I have invited a support team, an individual and services and their support team, to talk about how they participate in the person-centered support plan meeting and beyond. But before we do that, I'm going to do a brief overview of what a PCSP, or person-centered support plan, is. So for those receiving services from the Division of Services for People with Disabilities, or DSPD, they will have a formal person-centered support plan every year. And this plan has a few steps or stages. The first is the pre-planning stage, and this is where the support coordinator and the person get together and decide who they want to have at the meeting, when to have the meeting, where to hold the meeting, and how much the person would like to be in charge of their meeting. The next section of the formal PCSP is the action plan, and this to me is the actual meeting with the support team. So this is where you discuss what's important to the person in different areas of their life, talk about goals that they want to work on in the next year, and with the support team, the person will decide the supports they need and choose who will provide those supports. And the last thing is the support team and the person will decide what they're going to do if things don't go according to plan, right? And we know that things don't always go perfectly, or if the person does something that could put themselves in danger or someone else in danger. And these are all written into the PCSP, and I'm going to talk briefly about some of these items. But first, I want to remind everyone that person-centered thinking and planning supports people to have positive control over their life. We want to ensure that they are in charge of the decisions that impact their lives in all aspects of their lives. So it's crucial to separate what's important to the person from what's important for the person. And sometimes service systems are good at taking care of what's important for the person, but not always elevating what's important to the person. And it's important that what's important to the person is also has an element of it in what's important for them. So if you want someone to care about what's important for them, make sure there's an element of that important to them in it. So in pre-planning, this is, as I said, where the support coordinator and the person really get together to plan the meeting, who's going to be there, how they want it to go, and reviewing their goals and supports from the previous year. And as a reminder, goals can change anytime the person would like to. So maybe in the pre-planning meeting, they say, oh yeah, sure, let's keep the goals that we had from last year. That'll be great. And then you get to the actual meeting and they say, nah, I don't want to work on that anymore. Let's do this. That's great. They can change their mind at any time. And then in the actual planning, in the actual meeting and the action plan portion, you're going to talk about all the aspects of a person's life and what's important to them in each of those areas. The PCSP that we use incorporates the life domains from Charting the Life course, and there are 6 different life domains. All of us lead whole lives that are interconnected, full of a variety of different aspects and areas, and they all impact each other, right? We all have to decide where we're going to live, what we're going to do each day, how we're going to spend our free time, and so on. And people in our services also should be able to make those choices about their lives. The domains that, again, the service system tends to focus on are those healthy living and safety and security life domains. But those are only two of what makes up a whole and quality life for an individual. So considering as a support team all areas of a person's life is really important and keeps everyone on the same page to support the person in living their best life. So goals are a big part of the PCSP and are the drivers of what happens after the PCSP meeting is over. A goal is something in the future that the person wants to reach or achieve. They are the end results of what you want to have happen, not the supports to get there. Like respite is not a goal. Goals should be personal and written for the person using their voice when possible. And it should represent what they want, what's important to them, their interests, their values, and what brings them happiness. There can be as many goals as the person wants in their PCSP. Some may only want one big goal, and others will have lots of little goals. It just depends on them. But once those goals have been identified, the support team can then help the person choose what their services and supports will be that will help them to achieve those goals. If you would like more information about this aspect of the PCSP, there's a great training. The first one we did was on goals, supports, support strategies, what they are, how they differ, and how they work together to support the person. So again, you'll find that in our YouTube link of trainings. So as a reminder, supports don't always have to be provided by someone who is paid to do so. The PCSP allows natural supports, which are people who are providing support just because, as well as paid supports. So you might have a mix of natural and paid supports that will help an individual reach their goals. In fact, that's probably the best model to use, is to have both natural and paid supports. And then lastly, this plan backup. This backup plan includes backup and emergency contacts, as well as any risks and responses to minimize those risks. So specific risks should be identified and put into the PCSP. And I personally look at this section as the emergency contact or the emergency response section of the PCSP. And once we've done all these areas of the PCSP, we have finished the formal plan. And hopefully the results will be the person feels like they have more control over their life. They have more ability to choose the things that they want in their life. They have more value to their communities and engagement in their communities. And bottom line, a greater ability to live the life that they want, that life that they choose. So that is a brief overview of what a PCSP entails. And now we want to talk about what's your role in the PCSP. As we sent out a survey to providers and support coordinators and asked, what topics do you want to learn more about? One of the top 10 was, how do I participate in a PCSP meeting? So today I've invited some guest speakers to come and share how they participate in PCSP meetings, how they each contribute. So first of all, I would like to introduce you to Jacob Hansen, and he has his support team with him. Jacob is a peer support specialist at DSPD, which is a very new job, and we're so excited to have him. He works on the employment and inclusion team. One of Jacob's roles is to advocate for people in services. So if any of you would like to have Jacob meet with individuals you serve to help them advocate for themselves in their PCSP meeting, or if there's another way that you would like to use Jacob's many skills and abilities, please reach out to him. I'm going to put his email address in the chat because Jacob's really good at checking his email, right, Jake? And I'm going to let him introduce himself, and then he can introduce his team. I'm actually going to stop sharing so that we can see faces, if that's okay. Jacob, take it away.
Hi, I'm Jacob. Um, I have been in DSPD services basically all my life. And this is my support team. Haley, why don't we start with you?
Okay, thanks, Jacob. Do you want to tell them who I am on your support team?
Oh, yes. She's my support coordinator.
Yes. All right. Thank you, Jacob. Yeah, my name is Haley Neff. I am a support coordinator with Evergreen Supports and Advocacy, and I have been Jacob's support coordinator for about 8 or 9 years. So I've seen him through a lot of different situations and different life events. And I'm really excited for him to have this new job. He has started asking me more and more about his goals and getting copies of it, and he's keeping me on my toes. So that's good. And I think that the more he knows about his supports, the more empowered he will be. So I really enjoy that and working with Jacob. So Lisa asked that as a support coordinator, I just explain my role in the PCSP meeting and the planning beforehand. I don't really have anything like monumental or groundbreaking to share, but I will let you know kind of what my approach has been to the PCSP and how it's changed in the last few years as we're getting more settings compliant, and I want to involve my individuals more than say I have in the past. So one thing that I do is that a couple of months before their PCSP meeting, I always ask them about their goals throughout the year, but about a month or two before the PCSP meeting, I start to remind them, hey, we're having your annual meeting. Some people call it annual meeting, some people call it PCSP. It just kind of depends on the individual. So I'll try and use the terminology that they know the best. And I'll just say, educate them on it, tell them what it is. And then I've been starting to ask them where and when they want to have it, because I think that we always just assume we'll have it at the day program or we'll have it at their home, but it's their plan and it's their PCSP. So I've been asking people if they want to do it wherever they want and whoever they want to invite. Typically, it's still happening at the day program or whatever's most convenient for the team. But like Jacob decided he wants to have it in his home, and we picked a certain time, and you have to pick certain dates because people are busy. For one example, I did a PCSP on a Friday at a day program, and I found out right before the meeting started that it was bowling day, and it was my client's favorite day, and he had to miss bowling. And I was like, well, wait, we should not have his PCSP on bowling day then. So those are just some examples of like being cognizant and aware of not only the whole team, but the individual. I felt really bad that he missed bowling. He didn't really seem to care, but the next year I made it a point, like, let's not do it on a Friday or whatever day that he's going bowling. I send the Living the Life You Choose to parents and guardians and providers and to the individual if they're able to fill it out online, or I'll bring it to a meeting the month before the PCSP to kind of talk about it, make sure they understand that their goals are person-centered, that it doesn't just have to be, what we do every year, and try to encourage them to be really active in their PCSP. Some individuals, as we all know, maybe don't cognitively understand their PCSP, or they don't know how to contribute to it. So they have a guardian that you keep involved. But I always try to make it special for the person, like bring them a balloon, or, make sure we go around at the beginning of the meeting and say something great that they've done over the past year. Ask them if they want to share anything that they've been excited about over the past year. Prior to the meeting, I update the UCANs with the individual and or their team to ensure the most accurate data and up-to-date issues, concerns, and strengths. I know a lot of people will do the UCANs during the PCSP meeting, but for me, it just gets a little long. So I like to do it beforehand. I like to review it with them beforehand, maybe even just review it with the guardian if the individual doesn't necessarily want to go over the UCANs, because sometimes it can be a little bit difficult. And then so then I prep the PCSP and U-steps, try to get as much done before the plan as possible as far as logistics go, but then definitely leaving the review of goals and the 2s and 4s and all of those discussions for the actual meeting. I typically like to start the meeting with something fun or nice about the individual. And I always ask them if they'd like to introduce their team or if they want me to. Most of the time, my individuals will say, you can do it, or you can lead the meeting. With my clients that are a little bit more capable, I try to, get them to say, who's on your team, but it's just really the level of how they want to be involved. And I think as support coordinators and team members, we can kind of gauge that just on their body language or what they're saying or what they're not saying. I stick to an agenda usually, and we review the last year's goals, discuss human rights, behavior issues, have a life domain discussion, discuss current supports and services before getting into the fun part, which is creating the goals for the year. So I know that sometimes PCSPs can be really redundant, it feels like, and we just end up updating the same goals that we've had for years and years. I've really been trying to get away from that and really making it very person-centered. There's a lot of different ways to say a lot of different things. And I feel like we can be creative in how we do these goals. But I also ask the individual in the meeting prior and during the meeting, is this something you really want to work on? I mean, because we put diet and exercise in there, or reducing their soda intake, and nobody really wants to work on those goals. So with Jacob, he's expressed to me a few things because his PCSP is next month. So this was perfect timing. He asked me for a copy of his PCSP. So I emailed it to him, and he and I just had a visit this month, because I see him every month, to talk a little bit about what goals he wants to work on. So I will help him lead that discussion during the PCSP. And then, of course, take all the notes and write it all up with team input, of course. The support coordinator and team work with the individual to create goals that are important to them, but also address issues and strengths, and making sure that their health and safety needs are met. So Lisa, you just wanted me to talk about the planning meeting, right?
For now, we'll do some questions about what
So
happens.
after that, I just have everybody sign the paperwork and make sure that the individual's happy and good with their services that they have. And so that's how I conduct a PCSP in a nutshell. And I'm just so happy to be part of Jacob's team.
Thanks, Haley. Jacob, who do you want to introduce next?
Yeah, so my mom is Jody Hanson. We'll go to her, and yeah.
Thanks, Jacob. So before the meeting for the PCSP, it's important to talk about the plan that has been going on, and also the new plan and what the person's goals look like. Let them come up with the goals. Sometimes we as parents tend to choose goals that we think are going to be best for them, but it's important for the person to have the goals that they want. And sometimes we do have to give some ideas to kind of get the juices flowing. Sometimes it takes a little bit of time for them to understand. But it's been fun to see Jacob over the years start to understand it more and more. Also, before the meeting, you want to coach them on how to lead the meeting, because this is all about them, and this is what the meeting is for. And so, but sometimes our individuals don't speak with words, so we can use things like pictures or a PowerPoint of things that they like, something on their iPad. Sometimes even when they are able to speak, it gets really overwhelming for them. I know someone who he writes everything out with his parents. They go over things before the meeting and they write everything out that he wants, and then he can just hand the support coordinator that paper. as a parent, it's our responsibility that we support the person to have the meeting that they want. And during the meeting, it's easy sometimes for the parent and the support coordinator to start talking and excluding the person. And so it's important to remember that this is about the person and have them start the meeting. I like Haley's idea of that saying something nice about them beforehand and making it about them. And sometimes getting a lot of questions can be overwhelming for them. And so sometimes it might be a good idea to take a few breaks in between and let them kind of have a minute to kind of unwind a little bit. And I'll turn it back to you, Jacob, to
Okay, last and certainly least, not least, but that was a joke, is my house manager at the group home I'm staying in, Easy.
Oh, we're so frenemies, huh, Jake? All right. So I'm EC with Legacy Independent Living. As Jacob's provider, our role in his PCSP is to first listen and understand his goals and what motivates him. Then from there, we try to keep him consistent in achieving his goals. Based on this, we just create a support strategy tailored to Jacob's specific needs. I think one thing that was really important for Jacob or any other client that we deal with is to hire staff members who share similar interests with Jacob or client. We believe it's crucial to do this because it shows that our staff members are invested in their goals and we can build a strong connection with them. Understanding Jacob's thought process, behavior has given us a lot of knowledge to create a more structured and effective support strategy. One of Jacob's PCSP goals was to write another book. And I'm a big anime fan, so I was excited to hear what Jacob wanted me to watch. So I spent the last 2 months watching it and singing songs during our trips to U of U. But it also showed Jacob that I was committed to him. And I think doing that reassured Jacob he had a strong support system to help him succeed. Also, what we like to do is collect data. So sending our quarterly reports to Haley, and if he needs to adjust anything, I think it's super important for us to look back at it and, you know, try to make his support strategy even more better. Ensuring this, it helped Jacob reach his goals and happiness. And do I still have an IQ of 1, Jacob?
I mean, that was by your own admission, so I don't know. How do you feel?
I feel great. Thank you so much, Jacob.
Okay, I don't know if any of you have questions for Jacob and his support team, but there were a few things that I was curious about. And Haley kind of alluded to this, like what happens after the meeting's over, then what, right? I think this is when the hard work starts. So, you know, if everybody would like to speak to what you do after the meeting, I'd appreciate that. Jacob, do you want to start or do you want someone else to start?
I can start.
Awesome.
So I feel like the most important part is to like Casey said, the most important part is to work on your goals and try to achieve them. And also for your support team to actually, care about you, which I agree that with wholeheartedly. It doesn't do much good to have a support team that doesn't care about you because it's all about you. As far as this PCSP goes. So, yeah.
Okay, we'll go to Haley and then EC and Jody.
Sure. So, after we've completed the PCS meeting and I activate it and send it to the providers, I wait for them to send their support strategies for me. And then throughout the year, I monitor the progress on those goals. And I make sure that I ask the individual and their staff, are they even aware of their goals? Are you aware that Jacob has another goal to write another book? Are you aware Jacob wrote a book? Those kind of things that I think can sometimes get overlooked when we're just looking for the health and safety and we're just hurrying in, doing a visit and hurrying out. But I really like to sit down and talk with my individuals and remind them about their goals too, especially if they're maybe struggling with them a little bit. Remember when we had that meeting and we talked about this? And then the provider sends me monthly or quarterly summaries that I review. If there's anything concerning in them, I follow up. Same with any home visits. If the staff don't seem to know what I'm talking about in relation to goals, I would reach out to like EC, the house manager, and say, hey, I spoke with the staff. They had no idea that Jacob should be or wants to be writing for 30 minutes a day, which isn't the case. Legacy has been amazing with Jacob, and he seems like he's really been able to develop a lot of different things. And then also just making sure that Jacob is still happy with the goals. I'm going to do a better job of this. I know he asked me for a team meeting last month, and we're going to have one in November. So I'm trying to keep everybody's, things in mind, because I have told Jacob that it's a fluid document that we can change the goal at any time. Like if you feel like you don't want to write a book anymore and you're focusing on something else, we can do that too, so that the goals aren't set in stone, and just making sure that the client knows that I care about their goals and that I'm advocating for them when they feel like, or maybe I don't feel like they're getting worked on as well as they could be. So I think that that's, in a nutshell, my role after the PCSP.
If I might, that's part of why I asked for a copy of my PCSP, was so that I can know what exactly is in my PCSP, because it's been a while.
Yep. Yeah, and also, Jacob, sometimes with the PCSP, people write a lot of things about you, don't they? Instead of with you. So, your file came to me, and then I kept going with the file. And sometimes I feel like if we don't involve Jacob or his mom or his support team, then it just starts to be me writing about him instead of with him or for him. So I really enjoy his collaboration with the PCSP too. Like I said, keeps me on my toes.
I think he does that for all of us, Haley.
Which is good. And I'm glad he has this job so he can go out and teach other individuals to be good advocates for themselves, and to be able to speak up or use the tools that they have to be able to get their points across and have it be more about them than about the paperwork.
Thanks, EC. What's your role after the meeting's over?
So after the meeting, like Haley says, you gotta teach them how to advocate for themselves, because we can't read what they're thinking. They have to, verbally say, what's going on. So that was one thing that we had to do with Jacob, is give him courage to say what's on his mind. Since he did that, it was easier for us to pinpoint what we can do to approach his PCSP and structure him. Another thing that we had to do is motivate him. So keeping him happy, figure out what things that he liked to do, and then slowly approach that and switch it over to one of his goals. Adding, positivity around him, the environment. I mean, that was something huge that we had to do for him. And I think that that's what we did after. And then we finally, structured his goals together.
Thank you. Jody?
Yeah, so first of all, knowing what the goals are. When I first started with this, it was really hard. I didn't really understand what the PCSP was. I knew that there was a ton of paperwork and I was overwhelmed, and I didn't really understand what the goals purpose was. I think it's important to make sure that parents understand the purpose of the plan and what it is, because it actually took me a few years for me to kind of get the idea of what we were doing, and that staff was supposed to be working with Jacob on the things that the goals were set, as well as us as a family. And so, you know, just as you're working with your clients, making sure beforehand that they also know what the role of the PCSP is. But just helping Jacob with his goals afterwards and making sure, like Ethy said, to motivate him and remind him of those things.
So, and Jacob, you can speak to this too. Yeah, go ahead, Jacob.
And I think it's, well, I think it's important. My mind just went blank. And I also, let's see. Oh, I was just gonna say, I think it's important for you, the support team, to everyone on the support team, including the client, well, partly, I'm gonna say this with the utmost respect for DSPD, because, you know, they're the ones that pay my bills essentially. Sometimes I think the PCSP meeting could be demystified a little easier. And I only say that because just now, with me getting the job, I'm really beginning to understand what PCSP is. I mean, and how DSPD works. So I think that DSPD could do a bit of a better job demystifying, like, sometimes I guess, some of the jargon that we use and some of the terms we use, which is why in the new version of, I don't know if I can say this without getting shot behind the shed, but the new version of the Living the Life You Choose workbook that me and Lisa are working on terms and like a keyword table for like keywords that might come up not only in the PCSP meeting, but in DSPD in general.
Yeah, I agree with that, Jacob, because even when you say the action plan, that doesn't I mean, even that is kind of open to interpretation. And a lot of parents just see it as, like you said, kind of how we get the money again for another year, how we maintain services, but also it's the quality of services that we want to be able to showcase. And that's a really good point, Jacob. I'm going to think about that moving forward with some of my clients. I don't want them to be afraid of the PCSP or not understand it.
Yeah, and your mom spoke to that too. So it's a good lesson for those of us in the system. Um,
That's
the-
what gave me the idea.
well, I appreciate it. Thank you, Jacob. See, he's keeping us all on our toes. And Haley alluded to the Living the Life You Choose workbook, and it is a workbook. Unfortunately, right now it's not on DSP's website, but I will make sure that I'll link to it. The original version, not the one that Jacob and I are working on, but the original version will be in the training materials. So when you watch this video or after the fact, you can go to that folder and access the Living the Life You Choose workbook, which does go through the whole PCSP process from the role of the person in services and kind of walks them through how to prepare for it. And we might need to do a better job, though, Jacob, of talking about what happens in the meetings. So that's something for you and I to work on later. I want to go back to something that EC said, and Jacob, you said it's the support team is everyone, including the person in services. But EC talked about motivating you to work on your goals, and I think Jody alluded to it as well. So I just wondered how a provider can go about finding ways to motivate individuals. I realize we're talking about Jacob specifically, but let's generalize that to how can you motivate people to work on their goals.
By the way, I'm not going to get shot behind the shed for mentioning the workbook, am I?
No, your life is safe. No worries.
Your support team will make sure of it.
Yeah.
So like for one thing as a provider, I think for all the clients is communication. Every day, just giving them a call and saying, hey, how are you feeling? How's your mental status? What can I do for you? I think how Jacob says caring for them, that's one of our follow-ups. We just check in constantly, just making sure that they're doing okay. If there's something wrong, adjust, change things that can help them feel better about themselves and their life. And then we will slowly push that to their goals. Their mental status is, their mental health is super important for us. So if we keep them happy, we'll keep them going, it'll get them to their goals that they'll do.
Great, thank you. I have a question, Jody, for you. As a parent and a guardian, how do you balance that role? I know personally, I have a son in services, and there have been times when I want him to work on the goals that I want to set, and he definitely does not. So anyway, how do you balance that?
Yeah, that is hard sometimes because, as I said earlier, we as parents do tend to think that we know what's going to be best for them to work on. And, we really debated about getting guardianship because we wanted Jacob to be as independent as he could be. But there were some medical and financial things that he didn't want to have to be in charge of. And so we obtained limited guardianship for him. And so the way we approach guardianship is Jacob always has the first say. And if people start talking to us, we ask Jacob what he wants. And after a small time, they get the hint and start talking to Jacob. But we treat him as if he has his own guardianship unless he asks for help. And one thing that's important as well is to have our loved ones grow from their experiences, just like we do. Sometimes we think we've sheltered our kids since they were little, and we forget to let them speak up on the things that they want and give them choices. And even when it may not be the best decision, even if they make mistakes and fail at something, that's how we learn as well. And it's important for us to do that.
Thanks, Jody. And Jacob would like to have a moment. Go ahead, Jacob.
Sorry. One of the things I've always enjoyed about my mom's and my dad's style of guardianship is that they always make sure that I have the first say, like my mom said. And it's almost like I have guardianship of myself, but they're there if I need help. So
Awesome.
I guess what I'm saying is thank you, Mom, for being there.
That's worth the price of gold right there. Thanks, Jacob.
Absolutely.
My last question will be a round robin, and then we will turn it over to questions from anyone else in the participants. But what advice would you give to attendees at the PCSP meeting? So, Jacob, what advice would you give to individuals in their PCSP meeting?
Well, we're all, well, I'm saying we as in, you know, the entire support team, we're all, like, you are the entire focus, so don't be afraid to speak up. Well, I say speak up, but like, however you can communicate. Don't be afraid to advocate for yourself. Like I said, I made a request of Haley of emailing me my PCSP so I could understand it before we had the meeting.
Great advice. Thank you. Haley, do you want to go next? And then EC and Jody.
Sure. Yeah, thanks, Jacob. I think that that's good. I think that as a support coordinator, the way that I want to approach a PCSP and what I would let other support coordinators know is just, you know, make it fun and go with the flow and ensure that the client is having a good time and that and while our biggest priority is making sure their needs are met, we also want to make sure their voice is heard. Jacob has residential services, but before that, he lived at home and did the SAS model. So we've done a lot of different things together, had a lot of different styles of PCSPs, because it's a little different when it's just family at home as opposed to a big support team, right, Jacob? So just making sure that you include everyone and make sure that the individual is at the center of the PCSP. Yeah, that's, I guess, my advice.
Thank you, EC.
As providers, I think the biggest thing is just care. Care for whatever needs he needs to do. And Jacob, you're not a dollar sign to me. I think a lot of providers like to cash flow, cash flow, cash flow, but we're in this service to help. And I know Jacob took some of my lines about advocating, but you have to teach them how to advocate. So that is our job. And I'm not doing this for the money. It's because we love each and one of our clients.
Getting lots of hearts for that, EC. Thank you.
And you see, I may tease you, but you're not just an annoying quit to me.
Good to know. Okay, Jody.
Yeah, so I think, like I said earlier, I think I've kind of talked about our role, but I think that it's not just the SPD's role, but the support coordinators and the providers to help the parents understand as much as the individual. And so just, make sure that they're understanding what's going on.
Yeah, I mean, to speak to that, I was their support coordinator when Jacob was at home doing the SAS model. And I mean, you can't just show up and ask the parents to sign some paperwork. There's a lot to explain. It's not a simple document, because apart from the goals, there's also, the budget and different things that you have to go over, human rights, behavior supports that maybe they don't even know about, or they're unsure what it even is. So taking the time and not rushing and making sure that you answer people's questions is also really important, instead of just trying to get something off of your to-do list. And it might take more than one meeting. You know, some parents catch on really quickly, and individuals, and others, you know, it's still a couple years down the line where they're like, I just don't even get what the PCSP is for, you know, and you can explain it to them in different ways to help them understand it.
Great advice all around. Thank you, everyone, and thank you so much for your time. I haven't seen any questions come into the chat. I don't know if anyone has a question that they would like to ask our illustrious panel, but now's your chance. So I'll be quiet for a second and see. Raise a hand, throw it in the chat, come off mute.
I have a question.
Great.
Okay, ready? This is for Haley. Haley, I just recently had a provider send out an email to their team, the team for the individual, and they said it's time for this person's annual meeting. They sent it to everyone they could possibly send it to, including me. Of course, not the individual. I actually responded and said, is this annual meeting that you're having, tell me about this meeting, because I suspected that it was the PCSP. And so, and then I just called and I said, tell me about this meeting. How would you have handled that? Then I was informed that this was the goal setting meeting. And I said, this is not how this is done. Have you had that experience with providers before? This was a larger provider.
I wish someone would organize the meeting so I don't have to. No, typically it's me that sends out an email that says, hey, I've spoken with the family, or I've spoken to the individual, their person-centered planning meeting, or their PCSP, whatever the team kind of calls it, because I've just kind of gotten to know my caseload, where some people call it the annual meeting, or some people call it their goal meeting. But I'll say, you know, this is when and where we're going to have it. Does that work for everybody? I mean, I try to keep everyone's schedules in mind, but first and foremost, the individual, and make sure it works for them. I mean, full disclosure, I don't always email my clients because a lot of them don't have email or understand it. And sometimes when I ask them, hey, do you want to have your PCSP? Where do you want to have it? They just kind of look at me blankly, and I say, okay, I'll ask your mom. Is that okay? You know, those kind of things where I keep them in the loop. The PCSP is obviously a little bit more formal. So an intake meeting or a 30-day meeting, it might have been that too. I don't know, but I try to, you know, I try to make sure that everybody on the email and knows what we're meeting for and the actual reason, and not just a random meeting, because it is important.
Yeah, in this particular situation, they were way off in their dates, because this person wasn't due until February. So
Yeah.
well, it was a little bit confusing, but I was able to take the opportunity to educate them and say,
yeah.
We're not going to have this right now. And so I backtracked.
Unless the individual wanted to or something. Yeah.
Right. So it was a little bit early to do that. And we're going to put it off for a little bit longer until we have some other things, like important things. So I have a different kind of a caseload. And then is it okay? And maybe Lisa can answer this question, but is it okay if we seriously limit who can be there? For example, I have a provider that likes to have a behavior meeting at the same time, and it's true that in my particular caseload, we often have a lot of behaviors that are happening. But I just like to let them know, if you want to have a behavior meeting, we can do that in advance of this meeting. But this meeting is not a behavior. It's not a time that we're going to talk about all of that difficult behavior system. Is that okay?
Yeah, I mean, I agree that there's a time and a place for everything, and we definitely don't want the PCSP to just be like a behavior hashing hour, and then at the end we go, okay, we're keeping the goals the same. I think it's just up to the team and up to the individual and the guardian, what they feel like they can handle during a PCSP. I usually just give, behaviors, if they have a behavior plan, just a little bit of time. I don't want to go over everything in depth that they're doing. There's another time for that. And I guess it would just really be up to the individual and their guardian on who can be at the PCSP. I've told my clients, you can invite anybody. You can invite your best friend, you can invite coworkers, like you can invite whoever you want. And then, just let me know. And if you want to invite them separate from me, you can. It typically just ends up being the support teams, but I have had a couple people who've brought like a friend or something like that, which has been interesting. And some of those PCSPs, especially with like bigger providers, they'll bring everybody, the behaviorist, the nurse. There's 14 people there when that might not be what the individual wants. Maybe the individual just wants their house manager and their support coordinator and their mom, and that's all they want. And I think it's perfectly fine to tell a provider that, like, hey, this isn't the time and place for this. If you have follow-up questions, we can do it over email, or that's probably how I would handle that.
Okay.
You
That-
can use settings rule as the bad guy for that, because settings
Be like,
rule
hey, it's
clearly
settings rule.
state-
He doesn't want you there.
clearly
I-
states it's up to the individual. So, I would hope that the support coordinator will be invited, but it's who they want. So, to the extent that they give their consent, yeah.
Okay.
Otherwise, the
Okay.
provider shouldn't be bringing everyone and their dog.
Okay, and here's another question. So Lisa, I'm sorry. Here's another one. What do you do when there's an individual at the meeting that is causing a problem at the meeting? How have you handled this in the past? I had a situation just last week where I had to, this was a parent, not a guardian, just a parent, and I had to ask the individual for specific, I need to know when from you I can ask your dad to leave the meeting. So anyway, anybody have any experience with that?
I missed that last thing you said. Did you say you had to ask him to leave?
I did not ask him. I didn't have to ask. I asked the individual, I said, I just want you to be aware that your dad has already crossed the line before you came to the meeting. So at what point can I ask your father to leave the meeting?
Yeah.
And that's what you might have to do. And maybe we need to have an offline discussion about this.
Okay, I will. I'll talk
Yeah,
to you.
I think it's just person-centered. I fortunately don't have a lot of,
Well, that's what I did do. I said this.
yeah.
Dad, I said this meeting has to be about him and not about your grievances.
Yeah, you can always let them know that there are certain ways that they can express their grievances to DSPD, and just try and keep it as focused as possible. But I've definitely been in PCSPs where the parents are ranting or raving, or, the provider's upset about something, and you just have to use your interpersonal skills to make everybody happy.
Okay, I guess I just needed validation. I'm
Yes.
okay.
Yeah.
It's
And
not always easy. Not every PCSP goes to plan.
that's kind of the role of the support coordinators, to remind everyone why we're there. Jacob said it a few times. You're the reason for the meeting. So, focusing on the person. We do have a question in the chat. Mackenzie's interested in knowing how to help individuals who are nonverbal get involved in the PCSP. So does the team have any suggestions?
I think the tone of your voice, the way you talk to them, being animated, and they can read it off of you. Posture, sit up, right, stand up, and show you're engaged and you're confident in them. Eye contact, making sure you read them. I haven't dealt with the nonverbal, but I just know that if your tone is properly right, and they'll understand you a lot better. So like if I talk to Jacob, I tell Jacob, this happened, how do we fix it? But it's never in a stern, voice. It's always low toned and monotone and all that stuff, just so they understand that I'm not mad, but we're just gonna figure things out. So that's how I would approach it. it's body language, and they're understanding your body language.
I'm not mad. I'm just disappointed.
I've had a lot of individuals on my caseloads over the years that are nonverbal. I try to do things like if they're in bed a lot of the time, we have the PCSP just right in their room. So we're not speaking about them like out in the front room. Because I do have some clients that spend a lot of their time in like their hospital bed. Like I said, I just try to make it fun, say something nice about them at the beginning of the meeting, see if they have anything that they, if there's anything that parents, Mackenzie, I think you need to mute yourself.
Or do you want to clarify your question?
Oh, maybe.
No, I'm good. This is all helpful.
Okay, go ahead.
And also just leaning on people who know the individual the best, their parents, their guardians, providers that have maybe worked with them for a long time. So you can pick up on cues of what they like, what they don't like. Also, how have they been doing over the past year? Like when you visit them and you ask them about their goals, do they seem agitated? Or like we had a client who, I don't know who decided, it was probably the team, that he needed to be out of his wheelchair more. He needs to be out of his wheelchair more often at day program. That was what we decided. And about 2 months in, the staff was like, he doesn't like to get out of his wheelchair. It's like a safe space. And I'm like, oh yeah, that totally makes sense. Why didn't I think of that? Okay, we'll take it out of the plan. I went home, I took it out of the plan after talking to his mom. It was just something we thought he would enjoy doing, but he did not want to get out of his wheelchair and lie in a recliner that he's never sat in before. So just different things. And he's nonverbal, but you could just tell he would get upset when they tried to put him out, or they'd say, do you want to get in the recliner? Do you want to lay down on the bed? And he'd be like, and so it was just, sometimes it's a learning curve. Like, yes, we thought that would be good for him, but it wasn't. And so we changed it.
Yeah, behavior is communication. And as a parent of a young man who's not conversational, he does have words, but he's not conversational. We've had to be creative. Receptive language and expressive language are two different things. So just because someone can't say what they're feeling doesn't mean they don't know exactly what you're saying to them. So keep that in mind, right? Speak as if everyone understands everything you're saying. And just find ways. Most people have a yes and a no, or maybe they just have a yes, right? They have a way of expressing that. So giving them choices and opportunities to choose between two things. Yes, you want that. Yes, you want, you like that body language. And I think Jody has more to add.
I just wanted to say, just like people who are verbal, the point is to look at them and make them be a part of the meeting rather than just the support coordinator and the parent talking, but looking at the person as you're talking about things, and make sure that you're discussing with them and not about them.
Thank you. Haley talked about that, doing things with and not for, right? So thank you. Jacob, you got a thank you for your words of wisdom. Someone wants to read your book, so you've got a fan club coming. I wanted to quickly thank you for your questions. Thank you so much for being here. Thank you to our amazing Jacob and his
Lisa,
amazing
one
support team.
Oh, sorry, Lisa, 1 second. Jacob,
Yeah.
remind me the name of your book so people can look it up. I have a copy, but now I'm blanking on the name of it.
So it's called The Queen's Game, but you have
Okay.
to make sure to put my name in there.
And you can get it on Amazon, right?
Yeah, and Audible.
Oh, an Audible.
Oh yeah,
now.
and it's narrated by a really cool Irish guy, right?
Yeah.
Yeah. So that would be fun to listen to. I'm gonna put it in the chat, okay?
Nice.
But make sure to put my name in there.
Yep, hi,
'Cause
Jacob.
otherwise it pulls up a different book.
Okay.
Awesome.
Great.
Thank
Sorry
you
to
for doing
interrupt.
that, Haley. No, that was important. I just want to remind you this training will be available in the next week or so on the YouTube channel. The link is pinned in the chat, so everybody should be able to access that if you scroll up. Our next training will be November 21st at 1 p.m. That's a Thursday, the week before Thanksgiving, on rights restrictions and modifications. So watch for that invitation to come into your email in the next week or two. Thank you again, Jacob, and your incredible support team. We appreciate you being here, and everyone have a great week. Thank you.
Thank you, Lisa.
Dixie, did you have a hand raise? Okay. Thank you, Jacob. Is he already gone? He did a great job. Oh, I can stop recording.